Hello everyone. So today I make a video about the Lindsay Clancy case. Contrary to most people currently comment on social media about this case, I actually study forensic psychology and criminology. So especially when it comes to questions of not guilty by reason of insanity, this kind of thing, I know a thing or two about that. And currently I see so much misinformation about this whole case portrayed on social media. So what I want to do today is I want to debunk a lot of the complete bullshit claims Lindsay Clancy is making. I want to shed some light on things such as command hallucinations, intrusive thoughts, but also I want to go through her civil lawsuit and I want to explain to you why potentially her healthcare provider did actually not do anything wrong. And follow me on this because I will explain it to you in detail, especially when it comes to the medication. A lot of people, they only look at, oh my God, there's the list of medications, and they do not understand what was actually done, and they have no comparison as to what we usually do, how we usually treat patients. And they also don't understand the complexity of how you treat someone who has, for example, bipolar, psychosis, all these kind of things. So stick with me and I will guide you through this. Now, the first thing I want to show you is actually, let me show you this. So her lawyer currently is claiming she had a command hallucination. She heard a voice, which she had never heard before. Surprise, surprise. And just in that moment, this male voice told her basically to unalive her kids, and then the voice also never came back again. So now when you read the civil lawsuit, he suddenly claims what Lindsay Clancy previously had described as intrusive thoughts. They were actually also auditory hallucinations. Now, this is not how it works. And as you can see here, this is a quite old publication from 1988. And already there, they discussed the big issue of these one-off command hallucinations where people claim that's why I committed a crime out of nowhere. I've heard this voice, I did what I was told, and it never came back again. So I committed this horrible crime, but you can't hold me criminally liable because I just was insane. So now, as you can see, there were already studies done even back then, and it was clarified that less than 1% of individuals who actually receive a command hallucination obey them. And keep in mind, a command hallucination is, I had, for example, a patient once, he would out of nowhere just stand in the middle of the aisle, stop walking, and just lift a left arm, for example, above his head. And I felt so bad for him because sometimes he was literally standing there for like 7 hours straight, holding his arm in the air for no apparent reason because he had command hallucinations. Now, usually command hallucinations, they don't just start off by suddenly popping in your head and saying, hey, I think you should unalive some people. And then you say, sure, let me go on and do it. It usually starts with different things. Also, another thing is, as you can see here, they already wrote about the issue with the malingering for criminal defendants, that these command hallucinations is just, they provide an absolute mitigating factor, or even an exculpatory factor in a criminal trial, where the defendant can basically say, oh, you cannot lock me up for that because I was temporarily insane. And the thing is, no one can say, oh no, you didn't hear the voice, because, you know, the criminal defendant is basically the only one who could say if they have or not. So now back then, they actually, they invented like a questionnaire about assessing the whole situation regarding, was it, for example, reported before? Does this person has a history of hearing voices or whatever? However, it is also clearly stated in a lot of these publications regarding command hallucinations in the setting of a criminal trial that you always have to keep in mind, what benefit does the person have to claim they've heard a voice? And especially as a criminal defendant, of course, you have a lot of incentive for them to claim they've heard a voice. So another thing is, I mean, in Lindsay Clancy's case, what she did was she claimed she actually heard a voice and she didn't say it straight away to, I know, the first responders or police straight away there on the wherever she was. This is usually what you have with people. Like I saw people, for example, running in the middle of a motorway. They were hit by cars and they just stood up again and they ran again. And once you finally caught them, the first thing they said, like, no, now he's telling me I have to run in, I have to run in. And you try to say, who's telling you what? Until you realize, oh, okay, that's what's happening. Someone is hearing a voice and they do what a voice says. So this is usually something they volunteer quite early on, saying, that's what happened. The fact that she only claimed she heard a command hallucination once she had met up with her defense team is already a huge, massive red flag, because it's basically like, I mean, you can see what a lawyer does, or even the civil lawsuit. Suddenly they claim, no, actually, all these intrusive thoughts, they were hallucinations. So they really try to rewrite her whole story and suddenly attributing everything to hallucinations, no matter if it's true or not. And this is such a red flag. It's horrible. So the thing is, when you go for a legal insanity defense, so you're not criminally liable because you were temporarily insane, usually what happens, the legal test is that they ask whether this person was at the exact time of the crime, if the person was at this specific time so severely impaired that they did not understand what they were doing, or they did not understand that it was wrong. Now, let's say, I mean, Lindsay Clancy, she definitely must have understood that what she did was wrong. As soon as she was in the hospital, she even asked for a lawyer. I mean, there was a lot of presence from here, like, okay, I've done this, I might even need a lawyer. Her self-preservation, the need for self-preservation kicked in instantly, asking for a lawyer. The other thing also, you see, when she tried to go on and unalive herself, you see all the hesitation marks, everything, which means her need for self-preservation was still so huge that she couldn't even really complete what she was attempting to do. You know what I mean? So I try to keep it a bit more word-wise. I try to be a bit more YouTube friendly because I don't know how to react to certain things. But I've seen people, they were in different states of psychosis, and they also did certain things to their necks. And I can guarantee you one thing: it didn't look like what she did. I mean, when they were really so impaired in the grip of psychosis, what they inflicted on themselves, it was horrendous. And a lot of them, they didn't survive that either. So what you saw, all these hesitation marks and how she went through it, she was clearly in a state of mind. She was aware of her self-preservation. So now, the other thing is, intrusive thoughts are usually perceived something from inside your head. And this is very important, because a command hallucination, on the other hand, a lot of times when people experience an auditory hallucination that someone tells them something to do for the first time, you see people actually turning around and looking behind them, and they're like, who the fuck just said this? Or who the fuck's talking to me? And they look for the source, because the impression for the patient is if it comes from outside, so someone is standing behind me and they're talking to me, and not necessarily that this is inside their own brain. But I can tell you one thing: I had people, they heard voices, and some of them, it was heartbreaking to watch them really fighting. They were loudly screaming, arguing with someone who wasn't there, and just screaming, just shut up, just leave me alone, let me sleep. And it felt like absolute torture just watching them. Like, I was always like, oh my God, I don't know how these people go on with it, because it must be horrible if you have a voice constantly talking to you and you don't want to hear it. I mean, that's really horrible. However, what Lindsay Clancy is describing, it doesn't sound like an auditory hallucination. It really sounds just like thoughts. And I want to give you an example of an intrusive thought. And I guess maybe people are aware of this. Surely you have heard about a lot of people jumping from, say, the Golden Gate Bridge in San Francisco, right? And when you listen to people who survived it afterwards, they actually say, I suddenly had a hallucination. There was a voice telling me I should jump. But they've never been suicidal, nothing in their life, no history of mental illness. Now, let me explain where this is actually coming from. Because this is not a hallucination, it's an intrusive thought. And ironically, it's actually your own brain who tries to protect you. So, what happens is it's called the call of the void. And this phenomenon is very widely known. It's not just on a bridge, it's in a lot of high, like if you are high up on a, say, a rooftop, anything like this, or on a rock, cliff, anything, and suddenly people feel like, oh my God, there was a voice in my head saying jump, for example, yeah? Or otherwise you can also have, oh my God, that I should drive on the other side of the traffic. So, but what actually happens is, it's basically, so studies already found that this is also not uncommon. So between 43 and 60% of people actually have reported having experienced at least once such intrusive thought, but for no apparent reason. So what happens is your brain has a high-speed rapid threat detection system. Yeah, that comes a bit from the amygdala, but just to keep it simple, it's basically, it registers, for example, you're high up somewhere, and it tries to send you a quick protective message like, back up, you might fall. However, your conscious mind notices, hang on, I'm on a bridge. I'm just walking on a pathway across a bridge. So the message, what your brain says, back up, you might fall, doesn't make any sense. So therefore, your brain basically misreads the protective high-speed message your brain sends to you, and your conscious mind then translates it into, oh my God, we might have thought about jumping. It's basically just a miscommunication in your brain, because your conscious brain sees there is no active threat. Like the same, you drive on a road and you're not intentionally thinking, oh, I should drive in the other traffic head on, right? But it's basically your brain notices like, oh, there are cars coming. Oh my God, careful that you don't crash. And then your conscious mind is like, why should I crash? I'm on my side of the road, so I'm not on the other lane. So it's basically a complete mixed signal what's coming up. And a lot of times, if you have people with postpartum issues and they have suddenly thoughts about like, oh my God, I was thinking, I know, maybe, let's say, I don't know, they stand with their kid, with a newborn baby close to a lake, and then suddenly they have an intrusive thought like to drown it. It's not exactly that this is a hallucination of drowning, but it's simply the same thing. Like the brain sends a message about, oh, you're too close to the water, you have a newborn. And then your conscious mind is like, well, yeah, but I'm standing here on the footpath next to a lake. I'm not in the lake. I'm not throwing my kid in it. But you see, it's a mixed message basically from your brain. But it's an intrusive thought. It's uncomfortable, and people might be afraid, like, what the heck is happening? Because they simply don't understand the process of what's going on in your brain. And I don't believe for a second that Lindsay Clancy had an one-off hallucination that told her to do this to her kids, and then suddenly it never appeared again. I think it's completely bollocks, to be honest. Now, let's have a quick look at what we have here with the civil lawsuit, because I think this is super interesting, and I will guide you through what she filed here, and I will explain to you why actually a lot of the things the healthcare providers did not actually do something so wrong. Actually, to the contrary, they did a lot of things exactly as you would expect them to go about it. I want to give a little bit heads up, because a lot of times I'm accused that I have no clue about psychology or anything. And I just want to make one thing clear. Apart from studying the whole thing and working in the field, for the last 1.5 years, I lived basically in a house and 2 flats, and they were connected. And there was another couple in the other flat, and I knew them basically for years. And pretty much, so what happened was, the man in this relationship, he suddenly descended into psychosis. What happened was, At first, he tried some anti-anxiety medications. Then he was convinced he had ADHD, and he got ADHD medications. And within 3 days, it was crystal clear that he is on a highway to hell mentally. He became completely manic. Manic means you feel grandiose, you feel over the top, and then you are invincible, and there's all of this stuff. And the thing is, they can stay awake for ages, and basically, is if you're high on some drugs, this is what it is. Anyways, he completely wrecked his life over 1.5 years. He kicked his girlfriend out, everything. However, he continued to live in his flat, and no matter how much I tried with police involvement, emergency service, anything, we could not get him admitted against his will. But I will occasionally drop in some things from this experience, because he also then, now after 1.5 years, he finally came out of this manic episode. And I mean, if he was one of those people. I had, for example, patients before. They were so far mentally gone, they thought they were like the Queen of England, and they were convinced they have to storm the Buckingham Palace and take back their palace. So in that case, it's clear, okay, if you let this woman out and she runs the Buckingham Palace, she tries to break in and say, I'm actually the Queen of England, we have an issue. But she probably would not be guilty, because she would not be sane at the time. She was like in a complete different reality, complete detached from reality. However, what this guy did in the other flat, he was still able to attend to his job, and he would not claim, I don't know, I'm God or something. He was just completely manic, thought he was invincible. He had very weird beliefs, that's true, but he was still functional in a way that, for example, when the police showed up, they listened to him, and they were like, yeah, he's on high speed, it's like 5,000 words per minute. And he was talking about random stuff, and then he wanted to remove the floorboards, and then he wanted to do new plumbing and God knows what. But he was still functioning in a way that he would know what he was doing. There is a difference between if you suddenly wake up and you think, oh, I'm the Queen of England, I have to storm the Buckingham Palace, or if you're someone who thinks, oh, I'm high speed, I can do 5,000 projects at once, and I can do the plumbing, and I can do a new flooring, blah, 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 this kind of stuff. So this is the difference between someone who is not guilty by reason of insanity because they are really so far gone, compared to someone who has a manic episode but is still in a way in reality. So this I want to just make clear. I hope you can kind of understand where I'm going with this. And now let me just try to explain a bit what they allege here in the civil lawsuit. And I don't think necessarily that this will go well. And I explain why. By the way, if people say, oh, Patrick Clancy said this and that, listen, I know this guy is a victim. He lost his whole family. I understand it. But, however, he has an absolute ulterior motive, and that's his civil lawsuit. He wants to say his wife is not guilty by reason of insanity, because if someone would otherwise say, no, it was not caused by any medications or anything, she did this, his lawsuit would be absolutely ripped apart. So what he does with his testimony, I don't think he's an impartial witness in that case. I think there's a lot of, he has an ulterior motive. And also I think there's an absolute bias in his own head where he's like, oh no, I didn't marry a monster, So she would have never done this otherwise. This is also what we currently see with a lot of people on social media who seem to defend for their own life, like Lindsay Clancy. It's absolutely horrendous. Now, first thing is, here in this type of the lawsuit, they actually describe her prior postpartum history. And this is very interesting because I think when Patrick Clancy was actually on the witness stand, he did not claim a lot of the things he claims in the civil lawsuit. However, in here you can see Patrick described after the birth of their second child, Dawson's birth, Patrick described she had manic behavior for multiple days. She had episodes of decluttering to simplify her life, obsessively cleaning and discarding items. She said she felt amazing and on top of things. Her thoughts raced and she constantly felt pressure to be active. So, now, and then she got anxious approximately 2 months after postpartum. Back then, she was already offered Zoloft, but she declined it. Now, they claim this was already an indication of a risk for bipolar disorder because of this hypomanic behavior. Now, let me make something clear. A lot of people are familiar with the term baby blues, and this is usually in the first few days or weeks of giving after birth when the body goes through a massive hormonal crash. So the hormones, they were sky high during pregnancy, they suddenly drop. And then at the same time, people are dealing with the broken sleep pattern, the body that's healing, and the complete intensity of suddenly be responsible for a tiny human in this planet, in this world. So, and usually between 50 and 80% of new parents, they experience to some degree these baby blues. So, and a lot of new mothers, they can feel happy one minute and then suddenly they're tearful, irritated, anxious, or completely overwhelmed. And the emotions basically swing fast back and forth. But this is very common for people to experience. Now, however, there are some people who experience something what's commonly termed baby pinks. And that's basically the complete opposite, which means straight after birth, this is a bit what Lindsay Clancy here describes. They can feel really high. They have extra energy. They feel elated, super productive and euphoric. And this ranges also between 10 and 50% of new moms, especially in the first week or two, that they can have this absolute high. And then it comes crashing down into the baby blues feeling. So now, this is not necessarily bipolar. This is just normal going through the hormones and the changes. Now, a true bipolar disorder or a postpartum bipolar mood disorder is actually different. And that actually involves more sustained impairing. They would meet a lot of diagnostic criteria, and it also lasts longer. And one of the things is, for example, these people on a manic episode, that's what I tried to mention earlier, they can stay awake without sleep and they are not tired. The guy in the other flat, he kept me awake for days and nights on end, and he did not need any sleep. He was just full of energy. So, in addition to being able to go without sleep and not being tired, which is the opposite of what Lindsay Clancy actually claims. She said she desperately was needing to sleep, but she couldn't. She was tired, but she couldn't sleep. It's different. Usually, yes, they also display racing thoughts, but they also have, especially in the manic episodes, they have a sense of grandiosity, invincible, and a very risky behavior, risk-seeking behavior, for example. So now, when we go to what Lindsay Clancy now prescribes here with the birth of her third child. So they claim she demonstrated a significant activation in hypomanic behavior, and she went out for runs excessively. She woke up every day before the children at 4 a.m. Then she went for a run and all these kind of things. Now, this might look absolutely excessive. However, you need to see how a person acted before the pregnancy and before the birth. And it seems that Lindsay Clancy was already a very high achiever when it came to going for runs, workout, all these kind of things. So this is basic. She was even, I think, out on a run when she started going into labor with her third child. So this is something which is like, okay, it's not really unusual. I mean, if someone would suddenly start doing it and they weren't very athletic beforehand, then yeah, that's different. But at the moment, it looks as if she simply continued her high achieving sport ambitions, what she had before. Now, Okay, now here her sister suddenly said Lindsay impulsively bought into a Beachbody multi-level marketing scheme and purchasing products to resell. Well, not sure if this, I mean, it's not really some, I mean, usually you have people in manic episodes, they spend their whole life savings on random nonsense. So this is the extent what we see. Or the person in the other flat who basically made himself completely bankrupt within a matter of months. So it seems Lindsay Clancy she wanted to have, I mean, I think what becomes clear here is, regardless of being a nurse or something else, I think she wanted to have her own independence. I mean, yeah, her husband seemed to have earned a lot of money, and she wanted to be like, oh, look, I have it also, I'm this perfect thing of like, I'm a devoted mom, and I have a career for myself, and then I have it all under, I've basically all together. I wouldn't necessarily say that this is completely manic. I don't think so. Now, they claim it should have immediately suggested a bipolar disorder. However, you can only treat what you know. And I think Lindsay Clancy, I mean, look, she was a nurse. She should have seen these things straight away and saying, hang on, I think something is wrong. I react differently after pregnancies. I don't believe that she was actually open and honest with her healthcare providers about everything that was going on. Anyways, now here it's said at approximately 12 weeks postpartum, Lindsay's mood suddenly switched into anxiety and depression. Okay, well, but this is what I just explained, baby blues, baby pings, and basically the reverse. Yeah, this can happen, and it seems that's also something she had before. In addition, 12 weeks after, I mean, it just stacks up, and like you don't have sleep, you have two younger kids anyway running around, and you have to care for a newborn. Yeah, a lot of people might feel completely burned out at this point anyway. Now, it is claimed that she experienced debilitating anxiety, insomnia, sleeping only approximately 3 hours per night, exhaustion during the day. Now, this is where you can already see it. So it's not really manic anymore, because usually people don't feel like, oh my God, I desperately want to sleep, but I cannot. No, they are just bursting with energy. And you have to tell them, listen, you haven't slept in 3 days. How about you calm down? And they're like, no, I'm fine. I can keep going. This is the opposite of what she actually says. Now, they go on further to say, then she found Dr. Jennifer Tufts online, and she scheduled an appointment. And then she was prescribed Zoloft. And Lindsay didn't want to take it at first because of the breastfeeding concerns. Then she decided to start taking Zoloft in the middle of October because she knew she would need sleep. So then, after increasing the Zoloft from 25 to 50 milligram, Lindsay experienced a severe adverse reaction. She did not sleep for 48 hours, had racing thoughts, worsening anxiety, and felt awful. So, and they claim it was obvious warning signs of medication-induced activation consistent with bipolar disorder. Now, let me clarify one thing. The official guidelines from the ACOG and also the perinatal psychiatric recommendations commonly list as a first medication to give, first-line pharmacotherapy is SSRIs. And one of the most common is actually Zoloft, because it is specifically preferred in the postpartum period, especially when breastfeeding, when a mother is still breastfeeding, because they have such an extensive data showing there's a very low infant exposure via the breast milk. So basically there's a long track record where they say, okay, it's actually relatively safe for breastfeeding. The infant doesn't get much of this medication, so it's safe to take even when you have, if you're still breastfeeding. So this is actually, what you have. It is a first line, what you try, and then it's good. Now, the thing is, it is true what they allege is usually if you have someone with a bipolar disorder, simply giving them antidepressant is usually not what you want to do. Because thing is the antidepressant. So basic mania is a bit where you're basically on a high already. You don't want to increase serotonin and everything because it would basically go higher, 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 right? So you're not really calming them down. So this is not what you want to do. However, as I said, her behavior at this point was not specific showing, oh, this must be a bipolar disorder. This can still be in a normal range of what you have with postpartum. So nothing wrong with her trying out Zoloft because at this point, fine. Okay, we've got it. Now, if you would wonder what would be, even if they would have said back then, okay, there must be a bipolar disorder, what would you have given her? Probably the most common thing would have been lithium. And lithium is simple because there's a strong evidence for preventing any postpartum relapse in bipolar disorder when you have someone already on lithium. I highly doubt Lindsay would have ever said she wants to take lithium, but that would have been one thing. Now, what did they do next? Lindsay did report these symptoms to her doctor, and then rather than recognizing the significance of this reaction, conducting appropriate testing to determine why Lindsay had such an adverse response to a relatively low dose of medication, the doctor simply discontinued Zoloft and prescribed Ativan and Benadryl for sleep. Now, you know where the lawyers are going with this. They think it's all wrong, but actually it's not. It's not at all wrong. Now, an SSRI, such as Zoloft, they can cause an activation syndrome, which means it will increase the anxiety, the restlessness, and the agitation, and also insomnia. And people just say, oh, I feel so wired, okay? This happens a lot of times when you start taking SSRIs or when you increase the dose. However, it's also important to say, usually SSRIs, you don't just take it and it works in an hour. A lot of times SSRIs, it's why people say you need to take it at least, say, 1-2 weeks to gradually build up the amount of medication, and it builds up also in your system, and then you actually see the effect. So I'm not entirely sure about time frame why Lindsay Clancy, I don't know, claimed it was so quick, because honestly, usually if you call your doctor the next day, they're like, oh my God, it's not good. They usually say 24 hours now. Anyways, so what you have, if you think that someone has this activation syndrome on an antidepressant, and you think, okay, it could be that this antidepressant actually induced a more manic episode, this can then also unmask a bipolar vulnerability lying underneath it. So when those symptoms appear, such as 48 hours of no sleep and racing thoughts, then many clinicians, they discontinue the antidepressant, the SSRI, straight away before it actually builds up in the system, because it's important. An SSRI builds up and you need to wean people off it. So before they actually come full in effect and build up their level in the system, you rather want to stop it straight away before you have to wean them off again, because then you have it like it stays basically in your system. It's a bit like other drugs, or like alcohol. So just because you suddenly stop drinking beer doesn't mean there's no alcohol in your blood. When you make an alcohol test, so it needs to come down again, and this is just very hard. So you rather stop it. Now, why would she be given Ativan and Benadryl? Now, this combination of the short-term benzodiazepines is actually frequently used in exact this type of situation for people with acute anxiety, agitation, and severe insomnia, because it acts really quickly and helps to restore sleep and to calm the system a bit down. And you try to do this basically to mask these effects from the SSRIs in her manic episode anyway. And it makes it easier then to come off, because it dampens a bit the impact. So it should just generally try to calm people a bit more down. So even the official guidelines and perinatal practice is often recommended to use these two benzodiazepines for a short term, basically to bridge over until you find something else. Now, Benadryl is, as everyone probably knows, is an over-the-counter sedating antihistamine which can help with sleep. It is actually it is also recommended, especially also in postpartum periods, if you use it for short term. So basically, together, this combination aims to get the person sleeping again, which then means it would reduce the acute stress and after stopping the SSRI. And it's a short-term strategy, basically a troubleshooting until you figure out a longer plan. So now usually the next steps would be that you give this and then you monitor the patient and you see and you hope that basically this activation that had happened where she couldn't sleep, that this would then resolve. And then once it's resolved, you have a clearer picture of what might actually be underlying. And this is important because let me just say this. The person I told you about, the other flat, right, the guy, what he did, so at first everyone looked at it and thought, oh, okay, so he took ADHD medication, then he had a manic episode. It must be caused by the medication. However, if you have a manic episode, it is a little bit like fog on the water, and such a dense fog that you cannot see what's underneath. How do you want to judge like how deep is the water? Is there anything in the water you can hit with a boat or something if you cannot even see the hand in front of your eyes because there's so much fog? And this is pretty much what depression and the manic episode do. They cloud the view and it's hard to know what's actually underlying causing it. And I try to explain it again. The person in the other flat, the man, people would look at it and say, oh, it's probably the ADHD medication. However, as I knew him longer, I constantly said, look, I think it's not caused by actually the ADHD medication. I said to him back then, I think you have either bipolar or borderline personality disorder. And basically this underlying illness got just made worse by adding the ADHD medications. Now, he was in a manic episode. Now, the problem is, if you try to control a manic episode and you don't know what's underneath causing it, you have a really hard time to figure this out, because every medication you give to control a manic episode could cause a different reaction from the underlying actual issue. It's a bit like you see a fire, but you don't know what's burning. If you put water on it and it's a oil fat fire in a pan, then you just create a massive carnage if you put water on it, right? So it's basically you need to find the right fire extinguisher for the type of fire you try to control. The problem is, if you have someone who's depressed or manic, you can't figure out what's actually burning. You only see it's a fire and you try to be like, okay, let's just test different fire extinguishers and see what's happened. And it is not easy. Like when people think this is easy, why did they do this and that? It is absolutely not. Especially when you have someone, and there's another thing, when you go somewhere and you say, hey, I'm a nurse, I'm a medical professional, a lot of people think, okay, I can rely on what the person is telling me. Now, in Lindsay Clancy's case, I think she did not accurately report what she was actually doing, and she created also a complete mess with her different providers. Now, as we go along with the rest of the medication, you will see the carnage, basically what happened. But honestly, it is hard to simply blame healthcare providers because, as I say, you only see a fire, but you don't know what's actually burning, and that's the problem. And to be honest, I think if there were such issues beforehand, in different pregnancies, she should have gone straight away, or Patrick should have gone straight away saying, hey, by the way, she was manic after other pregnancies or whatever, and had communicated it clearly, but that didn't happen. Now, when we go further in the civil lawsuit, where was this? So now, okay, they had the Ativan and the Branadil, and then she said, okay, the insomnia basically got worse. She went to the hospital. They gave her trazodone for sleep, but it was not effective. And this is then the problem. So Patrick's mother, a nurse, called another nurse she heard good things about and asked, hey, can you also jump in? Look, it has a reason why you should stick with one provider and not go to different ones, because it creates chaos. And this is exactly then what happened. Now, she apparently reported to Nurse Paul that she was very frustrated and scared and extreme insomnia, all these kind of things. So now he prescribed her Prozac. But after only 4 days of Prozac, Lindsay then reported the medication made everything just worse. So, and then she informed, I guess, Nurse Paul that this wasn't working, so he discontinued it, and he then went on to prescribe her Remeron, Clonopine, and also Ambien. Now, here's now where it's actually getting interesting. Now, Lindsay says she experienced dissociation and she perceived the world around her as unreal, distorted, or distant, and she was unable to determine what was real, and she became forgetful, all this kind of stuff. Now, it is not uncommon with a lot of these medications. How do a lot of patients say? It's basically as if you're a bit like in a cotton world. You don't really feel there, as if you walk around like half sleepy. And a lot of people hate this feeling. That's why it's so hard to keep people with psychosis or with bipolar disorder actually on their medications, because they're like, it feels really shit and I can't think clearly and it's a nightmare, and you get it. I mean, you really don't want to do it. But the thing is, what she basically does is she is very impatient. She wants something that works right now. And also, I have to mention it, keep in mind, there are records that they encouraged her basically to have different strategies. Like usually you try to go with a CBD therapy. So it's like, let's create a routine, a sleep training. You have where you talk to a therapist, about different things. What is the evening routine? Maybe, to establish something. However, Lindsay claimed that all of these therapists were basically a nightmare. She couldn't connect with anyone, and it wasn't for her. She wanted, and this is also documented, she wanted to get medication. She's impatient. She doesn't want to wait. She doesn't even want to wait until medications probably kick in. She's like, no, it's not for me. That's shit. Give me something else. So, it's very hard to find actually a treatment for her when you have a patient who constantly says it's not working, it's not for me, I don't want to talk, I want nothing, that's it. However, now they claim here basically Lindsay reported the alarming symptoms after getting Ambien, Remeron, and Clonopine, and she said she was feeling anxious, frightened about what's happening. And then Nurse Violetta correctly considered bipolar presentation and prescribed Seroquel. So now, let me just quickly go over the other aspects. So she went to the A&E, or basically ER. She got trazodone to help her sleep. And then she got from Nurse Paul Ambien, Remeron, and Clonopine. Now, after the SSRI did cause an activation syndrome, which caused the insomnia and everything together, stopping it and instead using a short-term sedative was absolutely the right thing to do. Now, trazodone is frequently used as the next step for sleep in someone with depression and anxiety, but it might not work for everyone. Now, you can have Prozac is... Oh, hang on. Let me backtrack that one for a second. So, 1 second. Let me go here. Okay. So, no, I'm correct. So basically, what you also have, you have Prozac, but this is more from even more activating SSRI. So basically, it can actually then worse the insomnia and everything. So it's stopping it was basically the best option. Now, when you combine Ambien, Remeron, and Clonopine, this is usually the next line where you're going to in medications if the other things fail, which means if the trazodone and the short-term options, what you tried out, if nothing works, then you try the combination of those three. Basically, Ambien is, I won't go into detail the different types of the medication, a set drug or whatever, but I'll give you a quick explanation. Basically, Ambien is aimed to help with the onset of sleep, to actually fall asleep. Then you have Remeron. It's a more sedating antidepressant, which is often when you have someone, when they say they have insomnia, but also a low mood and anxiety. So you give them actually in a lower dose because it just calms the whole nervous system down again. And then you have clonopine, and this is usually a bit of a longer acting benzodiazepine. When you have someone who is so wired and on anxiety, so hypervigilant, it's also just to calm you a bit down. When someone's just racing constantly around, you just want to try and get the whole nervous system a bit down. So this combination is actually something that targets both the sleep initiation, that you can actually fall asleep, and then also the underlying high arousal state. So you just calm the overall nervous system down. Now, a lot of people are wondering, why can someone feel exhausted but is still unable to sleep? So this whole tired but wired state is actually very common in people with severe postpartum anxiety, and also when it's activated by SSRIs. It is a complete mixed mood. And basically the key mechanism is that the hyperarousal overrides the sleep deprivation. So you have anxiety, racing thoughts, and also keep in mind, this is not just a normal anxiety and racing thoughts, but you're also super hypervigilant because you care for a newborn. So mothers in this state are usually anyways completely wired because they have to take care of everything and just figure out every danger before it even occurs. So now, on top of all of this, you have the complete hormonal shifts after the pregnancy, and as I said, the fragmented nights for caring for a baby. Now, if you have someone who has an underlying bipolar vulnerability, which could be, now in that case, if you give them only sedatives, it may only partially dampen the symptoms. But what you actually need, you need a mood stabilizer to actually regulate the whole mood overall again, that you don't go from high, low. So now, now if you try multiple different sedatives and everything doesn't work and the person is still sleepless and exhausted, then it usually means that the underlying issue is you couldn't reach the underlying issue, which I always try to explain as if you have a tooth infection and someone says, oh yeah, I just put a new filling in it, but you actually need a root canal to treat the infection underneath. So now, usually what happens now is, so you go in a therapy session, CBT, about, you create a nighttime routine, all this kind of stuff with people, you try to talk with them about things. But overall, at this point in time, what happened so far is, so you stopped the initial SSRIs, which was the absolute right call to do. You tried trazodone. Okay. It didn't work. You abandoned then Prozac because it didn't work, which is also the right thing. You don't want it to build up and then you have to wean someone off. It's basically troubleshooting, like, nope, doesn't fit. Okay, bang. Then they used the combination of Ambien, Remeron, and clonopine, which was also the right thing. This is the next escalation stage, which is recommended for people with severe refractory insomnia and also postpartum. So far, there was nothing wrong with what they did. Now, they go on and say on November 29th, when she went to Nurse Violetta, she then actually considered bipolar and prescribed Seroquel, which is a mood stabilizer. And this is actually what you want if you have someone with bipolar. But then after starting Seroquel, Lindsay's condition is a dramatic turn for the worse, and she said she developed unaliving ideations and she had intrusive thoughts. And this is now where it becomes interesting, because now they say, no, it was actually auditory hallucinations, which I don't think so. openly. Now, she told her husband and her parents, and also apparently her providers, and she said she felt emotionless and like a zombie. And she said this is all caused by Seroquel. Then she went back to the nurse and she claimed she had lost 15 pounds, no appetite, and she was experiencing panic attack, confusion, and had a lack of attention over the past days. And then she claimed she was so frightened by hallucinations that she called this hotline seeking help. I don't think that she reported hallucinations. I think she said she has intrusive thoughts, to be honest. That's what I believe. Now, let's see what else comes. Now, she got a crisis team. She did not meet the criteria. Okay, now, Patrick says, and then informs basically the nurse and says, Lindsay is 10,000 times worse. Lindsay takes these medications. And he basically wanted to get Lindsay off the medication, start from fresh. And asked if this was a mistake. And then Nurse Yoletta continued to increase Seroquel to 400 per day. Now, let me quickly explain something. So Remeron is widely known that it can cause this feeling of disconnect and emotional numbing. That's actually very common that people report it. Now, Seroquel is often used especially for sleep, anxiety, and in general just to stabilize the mood. It is sedating, and but it can also, because it is sedating, it can also produce a feeling of like a zombie-like flatness. So because it tries to stabilize the mood. Basically what it does is a bit like a pendulum. You don't want the pendulum to swing from left, right. You want to have it for once in the middle. And you want this so that you can actually finally see what might be underneath, and not constantly having the blurred vision by depression mania. You want to stop it, and then you want to be able to talk to a patient, to go through a questionnaire, to actually see what might be the underlying cause of it all. So this was the main thing. So yeah, a lot of people, they say it's zombie-like, but to be fair, this is usually something, I mean, people either want to, I mean, this is always saying, do people want to stop the whole insomnia, mania, and depression and just feel stable for once, even when it's in a low mood or flat? And especially keep in mind, for someone who went through highs of mania and lows depression and highs of mania again, suddenly having a flat line is like, damn, I'm bored. You know, there's no up and down. It's suddenly just flat. It's unused. It's not very common, not very familiar to them anyway. So it feels very weird for them. So, however, there's also, and there are also several people, they report after they start Seroquel, they have a very restlessness, intrusive thoughts, all these kind of things. They can also have some unaliving ideations shortly after they started. Now, when it comes to the weight loss, it is very, very absolutely atypical that people lose weight on Seroquel. And I believe what it is, it's not so much about the medication cost to lose weight. I think what it more is, look, if you have anxiety, yeah, and you have what people call like a fluttering, unrest stomach, so anxious, and some people, they get even so anxious they might throw up and stuff. You're not really in the mood to stuff your face with random stuff. Like, you're not hungry. You're in a survival mode. You're anxious. You're hyper-wired. You don't need food. You're not hungry, any of it. So, and then when it comes to the like zombie-like state, I mean, you're not very likely in the mood to say, yeah, I want to have an all-you-can-eat sushi buffet, right? So it's just not. So it's more that you just, even like a lot of depressed people, they also, some overeat and others, they stop eating altogether because they say, I'm too depressed to even eat. I think that's more basically the psychiatric condition rather than actually the effect of the Seroquel directly to lose weight. Now, okay, here it is. So because the nurse didn't actually go on and increase the dosage to 400 milligram a day. Now, usually you would say, if someone is resistant to a medication, you might try to increase it short term to see what it does. However, if someone already tells you that they have negative effects, usually you wouldn't want to increase it. However, if you have someone in an acute mania, you can reach up to 400 milligram by day 4, and after that you could even get higher to 600 to 800 milligram if needed and tolerated. So, but usually you increase the dose when the response is insufficient, and not so much when someone says they have adverse effects. So I guess for her it was more like a trying out of, is it a resistance to the Seroquel? Because usually you try to give Seroquel for this type of disorder. So you think, okay, am I actually on the right path? Or is it just something else? So I guess it was just a shot in the dark. She tried it. It was like, okay, tell me what happens next. Now, after that, apparently Lindsay remained deeply depressed, had no motivation, and still unaliving ideations. But this is also a bit a question because, a lot of people, they say, it is not an active, like, I want to do something to unalive myself. They are more like, I just don't want to be alive if life means I'm miserable. So there's a difference. It's more like an inactive ideation, if you understand what I mean. Now, Patrick didn't speak again to nurse Yolota, and he said it was horrible, and she felt horrible all day, and she had, now they say, auditory hallucinations. Look, intrusive thoughts. I think that's what he means, because even here, it says, Lindsay told her husband Patrick, I have thoughts about unaliving the kids. And she also told her mother about these thoughts. She was paranoid and delusional. Other people could hear her thoughts. Listen, I call this absolutely bullshit. And if that's really what she told Patrick, now I have to say, listen, why the fuck did you not call police, emergency service straight away, or you would have driven her to the next hospital and say, I refuse to take her home. I refuse to take her anywhere where my kids are, as long as she has this shit going on. Because no, you wouldn't just stand there and say, oh, guess my wife told me I want to harm our kids and all these other things, and she hears random voices, and that's totally fine, and I leave her with my kids. Absolutely fucking not. I wouldn't even want to sleep next to her in that state. So whatever the heck he says, I don't believe it anyway. And I think, if I remember correctly, then actually on the witness stand, Patrick then said, oh no, she actually didn't say that. She only said it after she met up with the defense team. So this is already where it absolutely clashes from, okay, so you go on a witness stand, you suddenly have to backtrack what's written in your and your ex-wife's civil lawsuit. It's absolutely bullshit. Because otherwise, honestly, Patrick, fuck off. If you thought it's a good idea to keep her home and not immediately raise the bloody alarm when she would tell you that, it's a nightmare. I don't believe it. Anyways, they went on to go to the Massachusetts General Hospital emergency room for help. And then they suggested to go to the McLean Hospital for partial hospitalization, a day program, but then she wasn't suited for that. She reported again she was crazy, depressed, numb to all emotions, and can't feel love, and her life is becoming a disaster. Yeah. Could be. Okay, she scored high on the postnatal depression scale. Yeah, I'm not surprised about that. It's also a bit of a question because she scored so high. Keep in mind, you have people, it's a self-reporting. And this is a typical thing. If you ask a patient, okay, on a scale from 1 to 10, how much pain do you feel in your arm right now? They always say 10. It's always a 10. And it's hard to say because especially when you have people, when they over-report the severity about it, it's so horrible. Usually these scales are not meant for someone to reach the highest level, unless you think like, okay, if someone always says takes the highest, then it's usually you need to get the score a bit in a more realistic setting. This is a problem because a lot of people, they're overly self-reporting when it comes to those questionnaires. So now so now here we go. Now, Dr. Diaz, who was attending psychiatrist at the Women and Infants, concluded that Lindsay had no postpartum depression and rejected a bipolar disorder diagnosis because of no history of hypomania or psychosis in the family history. And this is now something where I have to say, honestly, I mean, okay, no one was there in the room, but at the moment, I don't even blame the psychiatrist because what she describes is still something where it's, okay, there's not really a history. I don't know what she even told him, but it seems what she reported is just not what she told others she told them. You know, I mean, I don't think she told Patrick exactly what she told those people. And I'm also wondering, where the hell is Patrick? Patrick, where were you in all of this? Why didn't you walk in and say, hey, listen, over the last 3 pregnancies, she always went bonkers. This is the history of it. Because listen, if you think a patient who lost the plot is then the right person to describe to medical professionals that they lost the plot, that's wrong. That's wrong. Look, the guy in the other flat I told you about, right? He was convinced there's nothing wrong with him. Absolutely nothing wrong with him. He would not see it. He could not see it. And unless you have someone like myself then talking to emergency services, to the hospital and to the police and say, listen, this is what he does, they won't see anything wrong with it. So yeah, it is so horrible important that other people say and tell the hospital what's actually going on. And to be honest, maybe that's also another issue, because if you have her walking in and telling a doctor, listen, I think I've got psychosis. A doctor would usually say, listen, when you can walk in here and tell me you might have psychosis, I don't think you have psychosis, because obviously then you don't have a break from reality. So the whole thing is basically a contradiction in itself. And yes, people say there are different levels of psychotic states, and that's correct. But the main thing is you have a break from reality. And the main thing is people usually don't realize something is wrong with them. So, and then, yes, this is just something, yeah, it's the way it was reported here doesn't make any sense. Now, Dr. Diaz was actually great because they told Patrick and Lindsay that Lindsay's symptoms might actually be because of the medication, and she recommended weaning off Seroquel. Now, they also said her symptoms might be more pharmacological induced than purely depressive. Yep. And they decided that the institution is not the right one. Then she went back to Nurse Violetta, but Nurse Violetta did not respond. She did not care. They claimed, then they just basically claimed she didn't get the correct treatment here. No alternative. Now, following the reduction of the Seroquel, Lindsay told her husband that she had again unaliving ideations and that she can't basically get through this. So, and she said, I need to go to McLean. Now, the interesting thing is actually in a New York Times New York Post interview, Patrick actually said that Lindsay texted him from the McLean Hospital and said, they're all nuts here. I don't belong here. So it is the interesting thing about what Lindsay says and tells other people is, yeah. Now, she went to the emergency room and they also suggested, okay, you should go in the McLean Hospital. And then she admitted herself there because of depression and unaliving ideations. Now, she feels detached, homeless, depressed, she has no energy and no appetite, of kind of thing. Her insight and judgment were limited. Yeah, this is normal for someone who is depressed, anxious, whatever. Now, they put her on a unit with a 15-minute unaliving checks, which is actually good. I don't understand what the problem is. But then they say it was all inadequate because she was admitted on New Year's Eve and there was only a skeleton crew over the holidays. Well, guess what? That's what it is. That's what you have in every single hospital because it is over New Year. And unless you have some emergencies, usually there's not so much going on. However, it already came out in the testimony during the trial now that it was not what Lindsay said. Lindsay said she was only playing with a bit of clay and God knows what, she didn't even see a doctor until days later. And that's not what happened. There were a lot of stuff they did. But once again, Lindsay did not engage in all the therapy actually available to her. They had tons of therapy available to her, but she simply said, it's not for me. So what the hell do you want to do with someone? You can lead the horse to the water, but you can't drink it for them. So, she basically says, talking therapy, not for me. All these other courses, not for me. I want to have a quick fix. I'm desperate. Give me some medications. But then whenever she starts a medication and it's not immediately an instant bang, it's great again, she says, like, it's not for me either. So, Lindsay, calm your tits. Yeah, calm down and just wait. Just sit on your ass. Other people go through this for years. You can't just walk around saying nothing is for me. She must have been such a bloody challenging patient. I don't know. And her husband probably was just annoyed with everything. I was like, Lindsay, just go somewhere. I can't hear it anymore. Now, then what she actually had, and this is important. This is important because the doctors in there did advise her that they advised her to stop the Seroquel and all benzodiazepines and instead prescribed her trazodone for sleep. And I think you will see on the overview that it was then only like 1 or 2 pills and then every day new prescribed. This is another thing why people say, oh, the prescription list is so long. Well, listen, honey, usually you tell people, yeah, can you please discard all the medication you have at home? Because obviously you shouldn't just stock up medication, take them all at once. Yes, and there were different prescriptions, always just for 1 or 2 pills of, for example, trazodone. So they didn't give her a whole pack of it. They were like, okay, we give you 1 or 2. This is now for tonight. We won't give you more because you don't want people to have a huge stack of these meds at home, which is also perfectly fine. But of course, then it looks as if the list is longer than what it actually is. Now, the thing is, Lindsay asked if she could go home for Cora's birthday, and she said herself, because her thoughts have improved since the Seroquel decreased. And they then agreed and said, yes, you can go home. Now she said, now I feel better. I want to go home. Now, they wrote in the discharge summary approving that she can go home despite having a limited insight and judgment and still an underlying, I say, a passive unaliving ideation. However, if basically, listen, if you go in a mental health hospital and you have a bunch of depressed people, right? And you say, so guys, what do you think about unaliving? You will hear 90% of the people answering, I just want this hell to end, but I can't be bothered to unalive myself because I can't even get out of bed. I'm too depressed. So yeah, it's basically a wish to end the suffering, but not directly saying, yeah, I have actually specific plans. I just checked out Google Maps how to get to the next train line. So, and this is the thing. If you have someone who is acute right now, I'm a danger to myself, and you ask them. And someone like Lindsay would say, no. And we see this in the court records that she said, still, do you actively want to unalive yourself? She said, no. Do you actively want to harm someone else? No. Even the day before she caused all this carnage at home, she still said no. So, and this is what people don't understand because they're like, oh, I should have kept her anyways. Listen, this is exactly the problem what you have in forensic psychology and in psychiatry in general. You have countries like, for example, the UK, where you can be sectioned. It's just by the doctor, and no matter what you tell him, even you say, I don't want to unalive myself, I feel fine, I don't want to harm anyone else. If the doctor says, nah, just in case, I keep you now here for a year, they can do that. and there's nothing you can do about it. Now, this is basically imprisonment, and this is what people here rebel against, because there were people with autism sectioned for 8 straight years, and they didn't even have a mental illness. They were simply autistic, and you can't get out. That's what, and I surely you don't want to do that, yeah, because otherwise people would say they locked away this mom, and she was just a bit depressed, and now they locked her away for 8 years. And this is apparently what Lindsay also told others. I'm just scared that they lock me away in a mental health hospital. I don't want to be there. So no. Then the other option is what you have in other European countries and the US, that you go by the questionnaire and you ask someone, do you actively want to unalive yourself? If they say no, you want to harm someone else, no. Then you have to say, okay, so it appears from what the patient reports, they're not a danger to themselves, an active danger right now to themselves or others, so you can't really hold them against their will, unless you jump through a lot of hoops. And to be honest, if you have a depressed mother, right, who says, listen, now we changed the medication, now I feel actually better, and I want to go home and I want to celebrate my daughter's birthday, the last thing you want to say is, no, we deny you going to your daughter's birthday, you will stay here. When you think, wow, maybe someone is finally upwards, yeah, after change of medication, she says it has all improved, so you don't want to destroy something she's looking forward to. It's understandable what they did. So now what happens next is in the limited insight and judgment. I mean, yes, it's what you have for someone who has anxiety. The judgment is thrown off because they're anxious about everything. If someone is depressed, they might not have a lot of insight. A narcissist also doesn't have a lot of insight. You know, it's not atypical. A lot of different things can cause the lack of insight. So now so basically what they said is they then called Lindsay, and he spoke only for 10 minutes, and he offered different names of antidepressants such as amitriptyline, and they say yet another antidepressant, the very class of medication that had repeatedly caused Lindsay to have adverse reactions. So now this is actually not true, because basically what happens is what happened here is they tried to wean her off the Seroquel, and this is a very common clinical pattern. What you see here, and it's called like a rapid trial and error adjustment. When you have a patient who reports a lot of times very significant adverse effects to a lot of different medications. So it's a little bit like, you know, if someone goes in a clothing shop and they're like, I don't even know my size. And then basically you say, okay, look, just go in the changing room. I give you different trousers, and then, oh, does it fit? No. Okay, bang. Next, does it fit? No, bang. So until you even just try to get close to seeing what might work, you have to do basically a rapid trial and error. However, I want to stress here that all these medications, or most of these medications, are not one of the medications where you take them an hour later they work. A lot of people, the first thing they notice taking these medications are you have the side effect first, and then usually the side effects subside and the positive side of the medications start to kick in as they build up, such as SRIs. Yeah, they build up over time. They don't just work straight away, but in the first few days you can have like headache or a dry mouth, all this kind of stuff, and you feel, I feel a bit shit, until they then actually start to work properly. So what Lindsay basically did was, every medication that she was given, it's straight away, it doesn't work, I've got the side effects, it's so shit, take me off it. And now people say, why the hell did you take her off it? Well, because she's an adult and she's allowed to make the decision. So look, they could have simply said, okay, look, that's the end of the line. We don't know what to give you. You say nothing works. You don't want to engage in other therapies. Every medication you say doesn't work for you. Maybe find a different provider since we can't help you. That would have been another thing. However, but they kept going. And not to mention that Lindsay was the one running to different providers. But they still tried to find something for her that works, which seemed to be increasingly challenging, but they still went on and tried to help. Now, the thing is, after she basically went on and said all this stuff from weight loss and analyzing and all this kind of stuff, it was the absolute right decision to wean her off the Seroquel. Especially after, say, already after a few days, it got so bad. So this is what you do. The first thing you do is you don't want to just drop them cold turkey. You try to reduce it when you think someone might not tolerate it very well. Then you switch to trazodone for sleep instead. It is commonly called a deprescribing and simplification, which means if you have a patient where you tried all sorts of different medications and it is hard to distinguish, is it now the mental illness? Is it, you also can't distinguish, is the new medication causing her having these symptoms? Or is it rather the weaning off from the other medication that's causing her to feel shit? So that way, what you do is you basically try to, okay, let's stop it. Let's go with short-term trazodone, so that, which is then at this point just a sedative, which has a rapid short-term acting agent. You try to get him to sleep. Again, it's not an active antipsychotic, but the goal is primarily now to restore the sleep, and by clearing some of the more complex agents out of the way, so that you try to restore a baseline of a mental state. And then once you have basically the baseline without all these interactions of different medications, then you try to reassess it again. And you try to engage again with her into an assessment, a questionnaire, whatever, and just try to see what symptoms are actually there, the severity of it, and then you try to start it again. Now, she actually stated her thoughts improved after the Seroquel decrease, and she wanted to leave. And this is clinically very important, because it does actually suggest that from her perspective, that the higher dose or the combination of the medication was linked to worsening her intrusive thoughts and the underlying ideations. So, then actually, once her intensified symptoms eased down a bit, also the acute stress did lessen, and she felt then even safe enough to say, I want to go home. And this is what you have a lot of times when you have a medication that was particularly numbing the emotions, that once the dosage basically goes down, it makes people feel a bit like, oh, as if you wake up again, if you've been under this big cloud and now you finally wake up again. So it feels a bit like a relief, because you start feeling a bit more again. So now let's just quickly assess again what he did so far. You have rapid successive changes, which is you increase something, you see the side effects, you wean them off, you stop, and you switch. Is increase, side effect, wean, stop, switch. This is very common. A very common setting you have in an acute crisis setting, when your priority is safety and clearing out potential side effects from other medications, just to see what picture of the underlying issue actually emerges, which means, this is basically what I said with the different fire extinguishers. You test them, can we somehow dampen the flame a bit down to see what's actually burning underneath. And this is also what they did with the guy in the other flat, what I told you about. When he went into hospital, they did a rapid onset, increase, change, switch, to find a medication that might actually work for him. I'm not a fan of that, but if you have someone in an acute crisis situation where you think, okay, this person is suffering so much, you don't want to go through different things, such as, we will spend 2-3 weeks of increasing a dosage of one medication, then spend 2-3 weeks to wean someone off, then trying out something else. It's similar if you have someone with a physical pain, and they say, the pain medication, that doesn't work. You don't just try to pump more into it, get them maybe addicted on morphine or something. No, you're like, okay, let's try something different. Let's try something that works. You test different ones out before you then actually settle. At first, you try to get them out of this acute pain or of this acute crisis, and then you assess, okay, what actually hurts? Is the leg problem? What do we have here? This is the kind of thing. This is similar with mental health. It's actually the same thing. If you have someone who is just screaming in pain, you give them pain medications, and then you can check, okay, now it's tolerable. You can tolerate the pain. Now we can do an X-ray of the leg. Is it broken or not? Then you see what's underneath. But if you have, it's the same with the mental health. So you try to find something that works first. Now, all of this together, it is what they did here is very common, especially in perinatal and also in the bipolar psychiatry setting, this rapid change in stop for medication. So this is not something uncommon, just to make this clear here. Now, they said on Cora's birthday, she was not herself, which is not surprising. Maybe you still feel like shit. And they claimed again hallucinations, and I call this absolute bullshit. Then Lindsay returned to Dr. Tuss and was switched to Valium to taper off the benzodiazepines, and she indicated at some point we might add an antidepressant. She was still experiencing depression. She had to force herself to do anything. The hallucinations, I still call it absolute bullshit. I think it was just intrusive thoughts. And then she got prescribed amitriptyline for 10 milligram. Later on, she was then prescribed for 20 milligram amitriptyline that night, but Lindsay did not sleep. So now they criticize here that it was another antidepressant is exactly what caused her to be so feel so horrible in the first place. Now this is incorrect, because what she basically did was she said, okay, let's switch to Valium so that we get off the benzodiazepines, and that's actually correct. So you try to have you try to go from a basically a shorter intermediate acting benzodiazepine to Valium, which is absolutely, sorry, I was a bit off here now. So what I'm trying to say is basically the switch to Valium is absolutely, it is absolutely correct, because what I try to say is you have things such as the other benzodiazepines, they act longer, and people sometimes feel like, oh, I have a hangover the next day, right? So they act much longer. However, if you have Valium, it's very active in the whole metabolism, and the whole it basically produces a smoother plasma level decline, and it's not so much of a like up and down. It works so quickly, and then you suddenly crash down. So you have, it's very good if you have someone who has a rebound insomnia or withdrawal symptoms, and because the other benzodiazepines, they're basically short acting, so it's a quick knockout. And instead you have with Valium, it's more like a continuous level, just overall to help you better switch off and calm the mind a bit. So this is actually correct, because in that case you have to think about, she comes off the benzodiazepines, which can cause a withdrawal symptom, and at the same time you try to still treat her underlying depression and anxiety as well. So it's better you have something that helps with both. Otherwise, if you have any type of these more short-acting medications, it's always bad, because they kick in a lot and then just short-term you come off again. It's a nonsense. Now, when it comes to amitriptyline, amitriptyline is different from the other antidepressants because it's a tricyclic antidepressant, which means the low dose between 10 and 20 milligram is frequently prescribed, because it's more of a sedating and sleep promoting effect than actually a full antidepressant effect. This is completely normal. You also have a lot of times amitriptyline prescribed for people with nerve pain, because it is not just an antidepressant, and it's not SSRI. it's more like slowing down basically the nervous system. So if you have someone with nerve pain, instead of giving them a lot of anti-pain medication, what you try to do is you give them something that slows down the signal of the nervous system so that there are not so many pain triggers actually sent to the brain. And her dose between 10 and 20 milligram, this is totally fine. It's a mini dose. Usually it makes you maybe a bit tired in the evening, but that's usually it. Now, what they did here with the first 10 and 20 milligram with amitriptyline in combination with Valium, it was also the right choice. There's nothing wrong with it. They still tried their best to find something to help her. They tried their absolute best. And keep in mind, you have a patient. I think this is the problem. In this situation, those providers, they faced a really high risk pattern of a fragmented care, which was driven mainly by Lindsay Clancy herself. She went to multiple clinicians independently, and she didn't want to engage in other forms of therapy, like the talking therapy, anything, because she said nothing is working. So she requested medications. Now, and as a nurse, she also had a lot of professional knowledge about when she went into these conversations. Now, the reality of the situation is you have adult patients and they have the right to refuse therapies, and they also have the right to go to different multiple providers. And you cannot force them to engage in any type of counseling or non-pharmaceutical approaches. Now, each provider and each clinician is responsible for what they prescribed her, but importantly with the information they had at that time. So it's important what she told them, and you know how the system is. Even if you check the system, you might not have, if you have someone going to 2 different doctors a day or even 3 different in a week, not everything might be on the system yet. So now, as I said, they can't force a patient to engage in other forms of therapy, and they can't tell a patient, look, stop going to other doctors, just stick with us now. And this is the problem what Lindsay Clancy basically did. It is unclear how much of the medication she even took. She reported different symptoms, they don't align, and she went to the different, and it's basically, she created a complete carnage. But what you can see is overall, these clinicians, they still try to help her with the best of their abilities. And if you have someone who says, I refuse everything else, I just want medications, and as it's even said, she told one prescriber, I'm really desperate now, something acting quickly. She's impatient with everything. So I don't think you can actually blame the medical provider in all of this, because they really had a hard time dealing with her. And I think nothing really satisfied her. Everything was just, in her mind, everything is just shit. I don't like it, and that's it. I still question actually how much of the medication she took, and I hope we see more blood test results that might provide more insight into what did she actually take, how much of the medication did actually build up and what not, because it's very troublesome what she actually reports. And now when people say, oh, but she was then diagnosed with bipolar and psychosis, yeah, listen, it happened after what she did to her children. It does not mean that she did have that at the time. Some people develop psychosis after a traumatic event or some stuff, so it doesn't mean she was out of her mind completely what she did. But this is a lot of things. This is the main argument here, what people bring up a lot, and I just want to quickly talk about this. A lot of people say, well, considering what she did to her kids and herself, she must have been out of her mind. Now, let's talk about this for a second, because this is really where it comes to the biggest issues in forensic psychology and also in psychiatry. What do you actually count as normal? Of course, you can say, hang on, someone who does this to herself and her kids, she must be bonkers. Okay, agree. Someone must be out of their mind. Let's go with it. Now, If you have someone who simply murders their spouse, where do you actually draw the line? Do we say, yeah, killing another person is usually bad, but let's say if it's your spouse, then it's totally, yeah, this person is bad, but yeah, you shouldn't have killed them, but it's still somewhat acceptable in our mind, so it doesn't mean you're out of your mind, so it's normalized. Because in order to be then criminally responsible, it must be like basically you're normal and you did a bad act, you did something criminal, something bad, and not mad. So now where do you draw the line? Is a rapist, will you say this is a mentally healthy person doing this to someone else? I wouldn't say this is healthy. A PDF file, which is ironic because PDF files, there are actually studies saying that a lot of these adult men, especially, they identify in their own mind more like childlike. So you could even go back to something, maybe there's some underlying issue. However, no one says, oh, this poor PDF file. Is it? No, we say, lock him up and throw the key away. The same happens for men when men murder their whole family, right? So what you have in the case is no one says, oh, the poor guy, he must have suffered from mental health. No one gives a shit. Everyone says, like, burn him. So it's very weird when people say, oh, but surely she's a mom. No, she's not bad. She must be mad. But where do you then draw the line? Where do you say this crime is mad and in this crime is just bad? Like when you look at, I posted the other day about the Amish woman who drowned her son because she was talking about a big fish and gave him to God and God knows what nonsense. She was in a complete psychosis. Now, okay, she was found not guilty by reason of insanity and she was sent to a mental health hospital. Okay, so she had a religious psychosis. Okay, now let's go a bit further. She drowned her son to give him to God and was talking about a big fish at the bottom of the lake. It was a religious psychosis. Okay, we agree on that. She's in a mental health hospital. Now, if someone would take an airplane, kidnap it, and fly it in a large building full of people in a capital city because they want to please a God and think, then I will live in paradise, do you think this is someone, a criminal who is bad, or would you say this is a psychosis with religious components? Because in that case, we have to redebate what we actually call terrorism. What about all these ISIS fighters? They go completely batshit bonkers, but it's their religion. But where do you draw the line? Is he in a psychosis with religion because he thinks he has to unalive as many people as possible to go to paradise? Or do you say, no, this is fine? But the Amish woman who says she wanted to give her son to God, that's a psychosis. So you see where the problem is. We have different measurements for different things. And the more you go into it, the more you will find yourself in an internal conflict. And this is common. When I study forensic psychology and criminology, I argued so hard with my professors because I couldn't stop asking questions about exactly the kind of stuff. Because another interesting factor is if you have a psychopath, right? You do a brain scan on a psychopath. Well, you will see there are different things going on in the brain. They have literally brain changes. You can see it in an MRI scan. It doesn't look like a normal brain scan. Now, this is not just a mental thing. This is a physical thing. It's like a physical disability. Now, if you have a dementia patient, right, who commits a crime, you say, well, can't be held accountable for what he did because he's dementia. He doesn't know what he's doing. At the same time, you have a psychopath who has proven brain changes where you can see on an MRI scan, and no one says, oh, this poor serial killer over there, this poor little guy, look at him. He has brain damage. No one is saying that. No, you say death row. But on the other hand, you would never send a dementia patient on death row. It's this kind of double standards what we have in our whole justice system. And I think with Lindsay Clancy, it's a lot of women, they think, oh my God, I could never hurt my child. And therefore, oh my God, poor Lindsay, she must have been mad. because they try to identify with her. And there is this complete feminism concept of the medical system doesn't care about women's health anyway. We are so neglected. This proves what we were talking all along. This poor woman was asking for help. She wasn't taken seriously. No, I think she was taken very seriously. I think she wasn't honest. She didn't tell people the full truth. And what I can see with her providers, when you have a patient who only wants to go with one line of therapy, and this is medication, they did everything trying to help her. And they did the right combination of meds and they did the right strategies. They went through this escalation process. Okay, this doesn't work. We try this, we try this, we try this. And Lindsay wanted something, a magic pill that works straight away. And I still believe she was not psychotic. I think, okay, she might have been depressed. I think she might have been depressed because she was overwhelmed with all these kids. And I'm just saying, when it comes to Patrick, right? Patrick, you claim your wife was so batshit bonkers. She was a danger to everyone. But at the same time, you decided, yeah, we had to let the nanny go because, she wanted more hours and Lindsay was home anyway. She was a full-time carer now. Brilliant. Listen, even if someone is just depressed, a lot of times you give them a cleaner because they can't keep up with the household, right? But what makes you think my wife is batshit bonkers and she's mad and a danger to everyone, including herself? Hey, let's just take away the last help, which would have been the nanny, and to keep on top of things because, hey, honey, you're home anyway. Make it make sense. Make it make sense. It doesn't make any sense. And I think Patrick is absolutely nuts for even saying that. It doesn't make any sense, and I don't believe anything what he's saying because he has this ulterior motive with the civil lawsuit. But Lindsay, I think she was a overachiever. She was a perfectionist, and she was overwhelmed with all these kids. And I don't know. I don't think Patrick would have been happy to have her home all day long, all the time, especially not when he was working from home. So I think there was a lot of tension going on anyway. But let's see what's coming out from them. But the claim to say it's all her provider's fault is completely wrong. Especially keep in mind, Lindsay was, for example, the one asking for Zoloft. She did ask for it. Yeah. So you can't blame the providers. I don't think the civil lawsuit will go anywhere. And maybe the only good thing about all of this is it shows the bias we have in our society still, where women regard it more of like, there must be some other explanation. She wouldn't do it. But you have Chad Dorman who unalived all his kids and everyone, and he said he thought he was hunted down by the CIA and God knows what shit, and people didn't even want to hear an insanity defense. They were like, no, he's an asshole. He's an asshole. Throw the key away. So why is it that we think, a woman does it, we protect her and God knows what, and the guy does it and he's just an asshole? People get lead by their emotions and not actually by the facts, because when you look at the facts, there's no valid fact that would lead you to believe that Lindsay Clancy did hear a sudden voice telling her to do this to her kids. And to be honest, I think a lot of mothers who would love their child so much, if they would hear a voice telling them to do this, they would either run out of the house calling 911 or they would do something else. They would be like, they're better off without me. This is what you sadly have. You have a lot of women, they think, I can't cope, I'm not a good mother. They do something to themselves, but at least they leave their kids alone. So that would have also been an option. And look at the irony of it all. She wanted to take her children with her, but she's the one still being alive. And when she tries to sob in the courtroom, I just have a look at the children. I think, I don't want to know what they went through in the last minutes, because it takes a long time to do this to his children, what she did. And I don't know if they were aware what she did to the other siblings. They screamed, yelled, but a lot of times we say about other defendants, I hope they see the victims' faces each night. They will never have a night's sleep again. They get haunted by the victims' faces. This is what I hope for her too. That's all I'm saying. So Now, for all Lindsay Clancy defenders, if you managed to go through this video, congratulations. I don't think you will listen to much because you're probably in complete denial. I don't give a shit about what you think. If you want to insult me, go down in the comment section and feel free to comment whatever the hell you want, because I don't give a fuck what you say. And for everyone else, thanks for listening, and I hope I was able to provide you some clarity. I usually don't do YouTube videos, so bear with me if there are any hiccups here, but yeah, welcome everyone, and I hope maybe we see each other soon, maybe make another video. Let's see.